All right, this lecture is about professional accountability in the work environment. All right, to begin. So, objectives include uh, describe the impact of stress, reality shock, and burnout on the individual and healthcare team, identify agencies responsible for overseeing workplace safety, explore strategies to manage personal and professional stressors, and then identify suggestions for improving the physical and social work environment. So, workplace safety includes some threats to our safety, and those in the healthcare profession include infectious disease, physical violence, ergonomic injuries, exposure to hazardous chemicals, radiation, and Sharp's injuries. And we'll go into those in a little depth here shortly. So, with addressing threats to safety, there's several organizations that are in control of workplace safety programs, and that includes OSHA, the CDC, the NIOSH, the ANA, Joint Commission, and Institute of Medicine. So, developing workplace programs, they identify potential hazards. So, they look at how do they keep the workplace safe. And they do that by looking to see what hazards are in place or what hazards might become potential hazards for workers. They then assess the degree of risk. So, essentially, workplace safety programs should protect staff members from harm and the organization from any liability that could result of this hazard. So then once they assess the degree of risk, they develop the safety plan and then they implement the program. Another thing they do is look at reducing risks. So workplace programs do develop the safety plan. They consult federal, state, and local governments. They distinguish between real and imagined risk. They seek administrative support. And then they also look at calculating the costs of each program. So, like we mentioned earlier, some workplace safety issues included latex allergies, needle stick injuries, ergonomic injuries, which those all include back injuries, repetitive stress injuries, toxic environments, and then also impaired workers. Another part of that is workplace violence, which nurses are definitely more now than ever frequently in close contact with individuals in distress. So it automatically makes us more of a potential target. And then we're often in situations where we are just at increased risk for workplace violence. I mean, socially too, is it an acceptable behavior? What policies are in place at your hospital or healthcare institution that um, address workplace violence against nurses? What are the state laws or local laws that'll all affect how uh, those who are violent against us are prosecuted, or um, can they face charges even? So look at the situation that you're in and identify if this is an issue with higher risk of workplace violence. Um, what you should know as a nurse is, does violence in the surrounding community also affect your workplace? And these are questions to ask in regards to workplace violence at the facility where you'll be working. I mean, it'll depend too. The community may differ depending on if you're here, say at Riverside Regional, than you are at Doctors Hospital or at Walter Reed, where it's a smaller community. Does the layout of the facility invite violence? Is there a prompt response by administration to violence? Who are your resources? Is there security 24 hours a day? Are incidents being reported to and addressed by management? Would training that deals with workplace violence be adequate for employees and management? And then two, make sure you know which types of patients are more prone to violence. Behaviors indicating a potential for violence. So some things that you might want to look at with patients or those you might care for. Box 12-2 on page 186 is a good example as well. But you want to know, do they have a history of violent behavior? Do they have delusions or any sort of paranoid speech? Are they aggressive? Do they have threatening statements? Rapid speech, an angry tone of voice? Do they have a stiff posture, clenched fists, tight jaw? History of alcohol or drug use? They male, gender, or a youth? Um, unrealistic policies too can affect that. So, when an assault does occur, sometimes there's blame placed on the victims. So, victim gender can play a role. Women receive more blame than men. Subject gender, female victims receive a greater amount of blame from women than from men. And then severity. So, the more severe the assault, the more often the victim is blamed. And again, you can look at box 12-3, page 186 for more information on this. So also, when an assault occurs, the beliefs might be in place. So the world is a just place. So for the person deserves this misfortune, or the age of the victim, the older the victim, the more he or she is held responsible for the assault. So keep an eye out with your patients and who you're caring for. Look for clues indicating potential violence. Call patients, family members, and visitors by their names. Encourage the patient and the patient's family to vent anger. If you feel uncomfortable, trust your intuition. Have another person go in the room with you just to be on the safe side, or have security come with you. Know your institution's policies and procedures. So another thing with preventing workplace violence is it's important that your institution have an ongoing prevention program. They should openly report all violent incidents and hold all patients, visitors, staff members, and management accountable for their behavior. Adopt a zero tolerance policy. And then participate in workplace safety. Assess the workplace regularly. Know your clients and patients. Be alert for suspicious behavior. Maintain behavior that helps to diffuse anger. If a situation escalates, remove yourself and call security. So we talked earlier about other workplace safety issues, which was the latex allergies, needle sticks, etc. Impaired workers was also on that list. So when you come into that situation, what are your professional responsibilities? So nurses need to uphold the standards of their profession. Ignoring substance abuse places clients and other nurses in danger. It's important to help a colleague obtain help. So common signs of impairment: you might be witnessing an employee consuming alcohol or other substances of concern on the job. Might be apparent in the employee's dress, appearance, posture, and gestures. Employees' use of slurred speech and abusive or incoherent language. You also might get reports from patients or coworkers. You're witnessing unprofessional conduct. The employee has significant lack of attention to detail, or you may even witness an employee stealing controlled substances. There are impaired nurse programs, or INPS. Most employers and 37 boards of nursing have strict guidelines. So the INPs conducted by boards of nursing work with employers to assist impaired nurses. And they say compassion from the coworkers is of utmost importance in those cases. So reporting questionable practices. Most employers do have policies regarding reporting behaviors that affect the workplace environment. There's also the Code for Nurses, which is specific regarding their responsibility. No, this is in regards to nursing responsibilities to threats of terrorism. which is something that has become more apparent, I'd say, in recent years. So, know your evacuation procedures and routes in your facilities and develop your knowledge regarding the most likely and most dangerous biological weapons. Monitor for unusual disease patterns, and then know the backup systems for communication and staffing. Okay, workload. So, rotating shifts, mandatory overtime, and staffing ratios play an important part with workload and workload stress. So, reporting questionable behaviors and practices. Most employers have policies regarding reporting behaviors that affect the workplace environment. The code for nurses is specific in regarding this responsibility. Workload can be included in that questionable practices part. So, behaviors endangering a client's health or safety, abuse of authority, violation of rules, regulations, or standards of professional ethics, and a gross waste of funds. What's a whistleblower? We've heard a lot of that lately. So, a whistleblower describes an employee who reports employer violations to an outside agency. Do not assume doing the right thing will protect you. Whistleblower guidelines. Gather the facts. Does the practice violate any actual law? Know the state law requiring mandatory reporting. Type your documentation and include date, time, day, and circumstances. Identify witnesses. Do not breach confidentiality in any way. Send a copy of your complaint to the chief nursing officer, nursing department, or any other department affected. Utilize the ethics committee of your institution, and then keep copies of your records. Moving on, promoting a healthy work environment. So, social environment. There's working relationships where you're involved with team building, communicating effectively, leadership skills. You want to develop a supportive environment. And then 2, what's your involvement in decision making? You want to empower each other and empower nurses by removing any barriers, reward initiative and assertiveness, and be role models. So, enhancing the quality of work life. Like I said, there's this social environment. So, develop working relationships, support your peers and supervisors, be involved in decision making. And then 2, be proactive in professional growth and innovation. So, encourage critical thinking, seek out educational opportunities, encourage new ideas, and then reward professional growth. So, professional growth and innovation, why is that important? Well, it encourages new ideas and critical thinking, and it allows you to seek additional educational opportunities and, again, reward that professional growth and gain more knowledge in your career. So, another part of promoting a healthy work environment is understanding cultural diversity. So, understand communication, space, social organization, time, internal or external control. So, there's organization diversity fitness. How do we know if an organization is diversity fit? Personnel reflect the current and potential population that the organization serves. Silence and gestures are respected. Awareness of special family and holiday celebrations. And then individuals are first, culture is second. How do we manage diversity? So be aware of and sensitive to your own culture-based preferences Explore your own biases and values. Be knowledgeable about other cultures. Be respectful of and sensitive to diversity among individuals. And then be skilled in using and selecting culturally sensitive intervention strategies. Do's and don'ts for managing diversity. So, do recognize it, value it, develop informal supports, ensure that you're fair, and make the preceding principles an integral part of your philosophy. Don't pretend everyone is alike. Expect everyone to conform to the prevailing culture. Seek a quick solution, develop different standards, and expect one workshop to solve the problem. All right. Another part of workplace issues is sexual harassment. So, behaviors defining sexual harassment include pressuring another to participate in sexual activities, asking another person about their sexual activities, fantasies, or preferences, and then making sexual innuendos, jokes, comments, or suggestive facial expressions to another person. More examples include continuing to ask for a date after the other person has expressed disinterest, making sexual gestures with hands or body movements, or showing graffiti or visuals, and then making remarks about a person's gender or body. So there's two forms of sexual harassment. Those include quid pro quo, where sexual favors are solicited in exchange for favorable job benefits or continuation of employment. An example of this would be an administrator approaches a nurse for a date in exchange for promotion. And then there's also a hostile environment, which this is the most common claim and the most difficult to prove. So the employee making the claim must prove that the harassment is based on gender and that it has affected conditions of employment or created an environment so offensive that the employee could not effectively discharge the responsibilities of their job. So recommendations from the American Nurses Association on fighting sexual harassment includes confronting, reporting, document, and then support. Addressing job stress and burnout to create a healthy work environment. So workplace stress, there's plenty of sources of workplace stress. A lot of them in nursing stem from inadequate staffing, from shift work and overcrowding. Why is nursing so stressful? Well, includes aggression and violence on the part of patients and their families, the death of a young patient or a death of any patient. There's high acuity patients, especially those needing resuscitation. Um, if you look at box 13.2, page 204, it has a good list of signs that your stress level is too high. And then also you want to look at box 13-5, page 205, is some good examples of coping with daily work stress. And then some strategies to help manage stress include promoting a healthy lifestyle, getting adequate sleep and exercise, doing some self-reflection on your personal role, mindfulness-based stress reduction, noting your physical response to stress, and then cognitive behavioral training where you learn to screen out negative thoughts. So also having realistic expectations of yourself and your new profession will also reduce stress related to unrealistic goals. Burnout. So there are stages of burnout. It is the progressive deterioration in work and other performances resulting from increased difficulties in coping with high and continuing levels of job-related stress and professional frustration. So nurses who identify themselves as having burnout attribute those feelings to the frustrations that arise from feeling they are not able to deliver care in an ideal manner. That seems to be a regular occurrence. So anything that interferes with providing the highest quality of care causes work stress and feelings of failure. So let go of guilt, fear of change, and self-blaming. Prevent yourself from wallowing in your problems to help buffer yourself against burnout. So box 13-7 on page 207 is another area you can look at with assessing your risk for stress and burnout. After that, let's talk about transitioning from student to professional nurse. Reality shock. So, definition: inconsistency between the academic world and the world of work. It occurs in new grads when they discover a work environment toward which they worked for several years and suddenly realize that they are not prepared. Often, new nurses are concerned about technical skills. So, students are taught to provide holistic care. Work reality may be very different than that. Partial task systems in the work world. So, the nurse ensures that tasks are carried out, but they're not the sole provider of care. A whole task system in the academic world requires complete knowledge, encourages loyalty to the profession, and is consistent with what is taught in school. I think a lot of it has to deal with balancing. There's definitely some phases for transitioning. So there's the honeymoon phase where everything in the work world is just as you imagined. Most often occurs during the orientation period. And then there's the shock or rejection phase where you actually come into contact with conflicting viewpoints, different ways of performing skills, a lack of security of an expert available as a resource. And then there's the recovery phase, where the novice nurse begins to understand the new culture. And the novice nurse experiences less anxiety and healing begins. There's the resolution phase, where the novice nurse adjusts to the new environment, work expectations are more easily met, the nurse has developed the ability to elicit change. So, inappropriate approaches for dealing with the shock phase. A native adopts ways of least resistance and mimics other nurses. You're a runaway. The real world is too difficult. They leave the profession or return to school. They're a rudder, considers nursing just a job. Or they get burned out, bottles up their conflict, fatigued, depressed, and angry. So you can also develop compassion fatigue, where you have a decline in compassion over time from exposure to events that have traumatized patients. You can be a loner, adopts the attitude to just do the job and keep your mouth shut. Or you're the new nurse on the block. You change jobs frequently and are always the new nurse who has to be taught. So the degree of reality shock may be less for new graduates who begin their career in the same institution where clinical rotations were performed. It may also be higher for students who choose to work in institutions in which they did not train. So causes of reality shock include role conflict, situation in which a person is expected to play two incompatible roles, or culture shock occurs when people are immersed into a culture different from that with which they are familiar and comfortable. So strategies to help you ease the transition. Self-confidence and self-esteem are important predictors of a positive transition from student to nurse. A self-esteem questionnaire can predict an increased chance for stress-related illness and decreased job effectiveness. Challenge yourself and understand the organization. Use problem solving and negotiation skills. Utilize role models and mentors. Experienced professional nurses who provide guidance to novice nurses regarding goal setting. So, attributes of a good role model include that they enjoy nursing, they have compatible professional goals or values similar to your own, they have a sincere desire to assist the new nurse, and they're trustworthy. And then self mentoring. So, learn appropriate references, develop problem solving skills, be willing to ask questions, and then become involved in professional organizations. Keys to survival during the transition: never fail to ask for help. Use available facility resources, re energize with professional associations, stay in contact with friends, evaluate your growth realistically, and then stay focused on your goals. So, developing your skills will involve organization skills. Um, Find a report sheet that works really well for you. You can contact former nursing instructors to discuss challenges too, and then learn to delegate appropriately. Delegation skills include um, developing delegation skills. So communicate face to face, learn how important body language is, follow up by putting tasks in writing, be pleasant and open to suggestions and new ways of doing things, be willing to change task assignments if indicated, offer help when you have the time, and then provide sincere positive reinforcement. Priority setting skills. This is very important as a novice nurse. So identify what are the patient's needs, how much time is required for a task, what tasks can I delegate, and what happens if I don't complete this task. Then decide who do you need to see first in the start of your shift. Clinical skills. So observe experienced nurses as they perform skills, especially those that maybe you haven't seen or have only done once or twice or only done it in skills lab. Provide the nurse manager and mentor with a list of skills that need further practice. And then use the policy and procedure manual to help you kind of guide as to how that clinical skill looks like on your unit or how they do things on your unit. Develop interpersonal skills. So make sure that you attend unit meetings and volunteer for committees. Take an active interest in the nursing unit. Participate in professional organizations at the local, regional, state, and national levels. And then make rounds with your physicians and assist with procedures. Take time to remember what is important to you. So another part of developing yourself is reintroducing yourself to your spouse, family, and close friends, and taking time to remember how important they are in your lives. Read a novel, participate in a health club or exercise, just go for a walk, and then learn how to enjoy the nursing profession in your new career life. So to review, you want to be able to describe the impact of stress, reality shock, and burnout on the individual and healthcare team. Identify agencies responsible for overseeing workplace safety. Explore strategies to manage personal and professional stressors. Identify suggestions for improving the physical and social work environment. All right, moving on to the nursing career. Objectives for this include evaluating personal strengths, weaknesses, opportunities, and threats, individualizing a resume to include objectives, qualifications, skill experience, work history, education, and training, to examine the components of the interview process, to analyze the factors involved in selecting the right position, and to determine how first-year planning is critical to career development. So getting started, it's never too early to start contemplating on what your long-term career goals are and how much the atmosphere is changing. Specialty jobs are always available. So begin by determining your present abilities for a position. SWOT. What is that? So a SWOT analysis looks at your strengths, weaknesses, opportunities, and threats. So your strengths, what's your work experience, education, knowledge, communication skills, people skills, computer skills, self-managed learning skills. What are your weaknesses? Do you have ineffective communication skills, inflexibility, lack of interest to further education, difficulty adapting to change, your inability to see healthcare as a business? Opportunities such as expanding markets in healthcare, new applications of technology, new products, increasing at-risk population and the nursing shortages. And threats. What are the increased competition among healthcare facilities and changes in government regulation? And then the SMART goals, which you all are very familiar with that. Managers will want to know what your career goal is, so plan now. SMART goal is specific, measurable, achievable, realistic, and timely. And this will help guide you to develop your career goal. There's also the MBTI or Myers-Briggs type indicator. Determines whether you have extroversion or introversion, sensing or intuition, thinking or feeling, and then whether or not there's judging or perceiving. So it's a widely used indicator of personality patterns, and I know that at one of the last hospitals I worked at, one of our staff meetings, they required all of us to complete this type of indicator, and it was actually a really educational meeting for everybody. So it provides a self-report about individual psychological type preferences in 4 dimensions. And we talked about them already, whether you're an extrovert or introvert. Are you a person who has sensing or intuition? Are you a thinker or a feeler? Or do you judge or perceive? So it can help you kind of identify the type of person you are and the type of people that you tend to work well with. So with beginning the job search, make sure to be engaged, stay informed, learn for employability, plan for your financial future, and then develop multiple options. Also build a safety net. And ask yourself, what oral and written communication skills do I have? Where should I begin looking for a position? What pearls of wisdom can I glean from other career nurses? The potential employer. So you should try to understand their ownership. What is their mission statement, core values? Assess the culture. Maybe talk with current and past employees if you have the opportunity to do that. You want to research your potential employer and learn as much as you can about them. With the initial interview, make sure you review your SWOT analysis, review the requirements for the position, professional appearance, maybe look at some background questions, professional questions, and then personal questions. What other opportunities are there for professional growth available? How are promotion and advancement handled? They always want you to ask questions when they ask you, do you have any questions for this interview? And then they always managers like to hear questions from you. And it can be as general as how are promotions and advancements handled, or what other opportunities for professional growth are available. So additional question tips. Here's some things that you should not do. Do not begin with questions about vacation benefits or sick leave. Begin with questions about the employer's expectations of you. Be sure you know enough about the position to make a reasonable decision. Ask questions about the organization as a whole. Bring a list of important points to discuss to help you if you are nervous. A second interview, and I have to say here, especially in this area, a lot of the first interview is like a telephone interview, and it's with the nurse recruiter for the facility, and they're just trying to get an understanding of who you are, if you might be a potential employee for the company. And then they also look at your interests and maybe try to find a good spot for you, and then they forward your application over to that manager of that department. So the second interview usually is the one where you're meeting the manager of the unit. You want to definitely dress professionally and be professional and pleasant. Do not smoke. Remember table manners. Avoid any controversial topics for small talk. And then obtain answers to questions you might have developed since the last visit or since your talk with the nurse recruiter. And then making the right choice. Look into the job content. Look into the potential for development in the nursing career and in your nursing SMART goals. Is it the right direction for you? The kind of work climate you want to work in? Is compensation where you're wanting it to be? The critical first year. So you want to adopt the right attitudes and adjust your expectations. Once you have that job, you want to manage a good impression and build effective relationships. Develop organizational savvy and master the skills and knowledge of the position. So, in conclusion, with finding your first position, it's more than being in the right place at the right time. It's a complex combination of learning about yourself and the organizations in which you're interested. Present your strengths and weaknesses in the most positive manner possible. Remember to recognize that the independence and the ability to do your own thing might not be the skills you need to keep you in your first position. Be a team player, learn about organizational politics,